Hi, Elizabeth. Thank you so much for being here today.
Hi, Michelle. Thank you for having me.
So can you tell the audience a little bit about yourself and the different settings that you have worked in?
Yeah, absolutely. Again, my name is Elizabeth. I am a licensed marriage and family therapist, or otherwise an LMFT. I have worked in many different treatment settings. After I graduated, I did my internship. I completed that in a substance abuse treatment center where I provided residential treatment, where the clients would live there for 30 days or more, partial hospitalization, and intensive outpatient. I've also worked in the jail doing intake screening. So any inmate that comes through, they received a mental health screening. And for a significant amount of time in my career, I worked for a major health organization, and I was their intake therapist and also would their crisis specialist, or their crisis therapist. So I would assess new clients and get them linked with services, and also evaluate whether or not somebody was appropriate for hospitalization. While I was there, I created a training to help therapists recognize the unique presenting problems that first responders come to treatment with, or reasons why they don't tend to seek treatment, to help clinicians better work with first responders. I also have provided various mental health trainings for probation departments throughout Northern and Southern California. I've worked in the emergency room for a local hospital, and again, doing more of like that crisis intervention work, linking people to resources, coming up with a plan, and again, determining whether or not inpatient was appropriate. And then most recently, I have my own private practice that I operate virtually, just with the change in times.
Wow, so you've been really busy, and thank you for all of the support that you've been providing the community.
Yes, yeah, absolutely. You're welcome. Thank you.
So how does someone know what level of care is needed? So if I'm Googling, I need therapy, how do I know I need a private practice versus like hospitalization or an inpatient or outpatient program?
Yeah, that's a really good question, especially if this is your first time seeking services, trying to find increased support. So basically, what we would say is let's look at kind of the impact on your daily functioning at home, at work, at school. What is the level of impairment? So sometimes I use like a medical or physical injury analogy. If I have a broken finger or a sprained finger, maybe I can wear a splint or something like that. But if I have a pretty severe back injury or something, I should probably seek professional help, additional support. So it's really just kind of assessing your level of impairment,
Mhm.
and how it's affecting your functioning. So, for example, I would say if somebody is experiencing mild to moderate levels of anxiety and depression, and they're wanting some coping skills,
Mhm.
then I would suggest finding an individual therapist, possibly a support group, and going that route. If somebody, another example would be if somebody is struggling with pretty severe substance
Mhm.
abuse, alcohol or some other chemical substance, then I would recommend a more intensive setting. So intensive outpatient, sometimes they meet 3 days a week, but they go home at the end of the
Mhm.
day. Partial hospitalization, I've seen programs where they stay there, and I've seen programs where they go home, but it's more intensive, sometimes 5 days a week. And then residential would be I'm out of my home. I live at the residential program. It's very intensive, 30 days, give or take, something like that. So my suggestion would just be to look at the level of impairment, and then if you still have questions, you can always contact a therapist,
Mm.
and you can also contact your insurance provider to see what type of services are available.
So that's such good information. How would someone go about and find a therapist?
Yeah, that's also another hurdle that I've heard quite
Yeah.
often. That's a very good question. So again, you can contact your insurance provider,
Mhm.
and ask for a list of therapists or providers that are in network.
Okay.
So they can give you the type of therapists or professionals that they would recommend, and then also someone that your benefits would cover. There are certain treatment modalities that sometimes aren't covered, or if you have a specific insurance company, they're more of like an HMO thing. Sometimes you do have to kind of make that decision whether or not to pay out of pocket to find the specific
Mhm.
modality or the specific therapist that you're looking for. A great resource to start with too is psychologytoday.com. They have it's just a very simple search engine. You go on there and immediately on the homepage, it says find a therapist, and you enter your city or your zip code, either or, and you can filter out the results based on, this is my insurance provider. Gender of the therapist, I would prefer a female therapist, the ethnicity that they work with, the language that they can speak, and also age. So if you're looking for someone, I need a therapist locally that will work with my teenager or my elementary age student, you can filter out by age as well.
Yeah, and we'll include that link below. And you mentioned elementary school and teenager. How,
Yes.
as a parent, would you know that your child needs therapy?
Yeah, that's a really good question. Especially when they're so young, they're going through so many different developmental stages, and that's the whole point of it, right? Is that they're kind of navigating these challenges and overcoming them as they mature. So I'd say a few things to look out for that indicate that your child would benefit from therapy would be any sort of changes in their eating or sleeping habits, destructive behaviors such as alcohol or drug use, if they're expressing extreme feelings of sadness or worry, let's say disruptive behaviors such as acting out, like talking back to teachers and getting in trouble in school or fighting with their friends.
Mhm.
And then in terms of friends, kind of piggybacking off that, any social isolation that you notice that would be out of the norm for them. Additional signs would be some sort of regression, such as bedwetting, excessive fearfulness, tantrums, and clinginess that would be unrelated to a major life change. So a major life change, for instance, would be there's a new baby brought into the home,
Mhm.
or the family moved houses or states, or there's the parents are divorcing. So those things we can understand that there'd be increased stress. So I would say if they're experiencing that regression
Yeah.
outside of any big major change. Another one would be increased physical complaints. So sometimes mental health issues in kids manifest as physical symptoms.
Mhm.
So if your kiddo is complaining of like headaches or stomach aches, and you've already gone to your healthcare provider and kind of ruled out any medical cause for that, then it might be time to seek some support from a therapist.
Wonderful.
Yeah.
And I'm wondering what would I hear a lot about the word stigma.
Yes.
So stigma prevents people from seeking services. Can you speak a little bit more about what stigma is and the barriers that it causes?
Yeah, absolutely. So stigma, essentially comes from a lack of understanding or fear. So there are some major types of stigma. There's public stigma, kind of just how society views mental illness and kind of the negative attitudes that they carry about that. There's institutional stigma. So this would be more of like policies of government and private organizations that intentionally or even unintentionally limit opportunities for people with mental illness. And then you also have the big one, the self stigma. So these are my like personal negative attitudes that people with mental illness have about their own condition that lead to symptoms of like reduced hope, maybe lower self esteem, increased psychiatric symptoms because we're not seeking services, so our symptoms are just kind of escalating.
Mhm.
Difficulties with social relationships, communication, and reduced likelihood of staying with treatment. So, byproduct of that too is they're going to be experiencing more difficulties at school or at the work environment as well.
And I know you've done a lot of work with first responders. Can you
Mhm.
speak a little bit to the stigma within the first responders community and how that impacts receiving services?
Yes. So there is definitely a stigma that exists amongst first responders, and I think it's multifaceted. There's it's in terms of the training that's provided, the resources that are provided to personnel, and then also it's just part of the human condition that we have our own belief system, and we take that into our work. So that's there was this poll that I had researched. It was a 2019 poll from the American Psychiatric Association, and they found that mental health stigma is still a major concern in the workplace, with about half of the workers being concerned of disclosing mental health issues for fear of losing their job. So
I got
think,
shivers once I heard that.
yeah. And I think it was like, let me get this exact statistic. I don't want to give you wrong information. Yeah, more than 1 in 3 were concerned about retaliation or being fired, and only about 1 in 5 workers were completely comfortable talking about mental health issues. So we talked about how do you find services. This is another thing. This was another issue that popped up in this poll, is that even those who said that they would support a coworker who was struggling said that they 1 in 4 said that they wouldn't know where to turn to get the help. Yeah. So there is a stigma that exists, and I think so. First and foremost, if we start with that self stigma, if I'm experiencing some form of impairment in my personal relationships with something I'm personally struggling with, and I have a stigma about mental health, and I don't seek services, really, I'm kind of lacking the coping skills or the ability to work through those stressors without them causing other problems or increasing in severity. And this is the part of that. If I have my own personal stigma about mental health, and then I am a first responder, likely I'm going to carry that stigma with me when I go to work and I'm contacting people that are experiencing a mental illness. So one of the major statistics that gets thrown around is that 1 in 5 people are experiencing a mental illness. So if we think about that in terms of first responders, the likelihood of you encountering somebody with a mental illness in a 12-hour shift is almost guaranteed. Yeah. So, and then as well, or something I was thinking about earlier is stigma in regards to departments, like large agencies, whether it's the fire department, a police department, a sheriff's agency, or even your hospitals for our trauma nurses and doctors and the support staff. If you Google a list of what who is a first responder, you're going to get a pretty extensive list. So, I mean, that includes dispatchers. There's a very long list, and then we have to kind of ask ourselves: are these people getting adequate access to resources? And if I'm saying in my workplace that, yeah, I'd be willing to help my coworker who's suffering, but at the same time, I don't even know where to start. So that, I think that's a concern. And I think too that the stigma exists. And one of the other alarming facts about that was that that poll noted for there was like a generational component to that. So millennials were twice as likely to seek out mental health services than baby boomers. And when we think about this fact, if the baby boomer generation is carrying more of the stigma, and then these people are, have been with their departments longer and they're kind of at that command level, are they initiating the discussion about increasing resources for first responders and their families, or is that kind of lower down on the priority list? Because it's not to say that they're completely ignoring it. It's just kind of where is it at in terms of increasing resources and providing adequate resources to their personnel and their families.
Yeah. So in your personal opinion,
Mm-hmm.
what as a community or as an individual can be done to support? What does support look like? And what is helpful support? Because what I might find helpful might be different from
Mhm.
what my coworker finds helpful.
Right.
Where do we start?
Yeah, I mean that's a loaded question, and I think we could honestly spend hours talking about it, right? I think to simplify it, it goes back to the conversation that we had about stigma,
Mm,
which we identified comes from a lack of understanding. I think that various first responder agencies and kind of more or less focusing on fire and law enforcement here specifically, they've done a tremendous job increasing support services and providing training for their staff. But I do think that there is a lot more work to be done. And I think I can say that as a clinician, and I can say that as a former first responder. And that's kind of my wheelhouse. That's what I'm really passionate about, is bridging that gap between first responders and mental health. Is
mhm,
that I really think it just comes down to more training and education. So I think that we could do a better job at normalizing mental health treatment and educating our first responders on the benefits of treatment and the resources available to them. And that goes along with their families as well. So like, linking families with resources to how to support their first responder, if it's their partner, or maybe there's some conflict, tension arising in the family, difficulties communicating. How do we increase support for that family to resolve conflict and increase communication in light of this, really stressful career that mom or dad goes off to?
mhm. Yeah.
Yeah, I think that's where it would start, and then um, like I said, just really education, because I'm thinking like, how can, so if I'm the spouse of a law enforcement officer, how can I support that person? What does that look like?
Mhm.
And educating on that. Like, a few of the things are, being patient, easier said than done sometimes. Learning how to use active listening, or
Mhm.
I statements, so that we can kind of address our feelings and our concerns without increasing the chance of conflict arising or defensiveness out of the other person. Some other things that we can do is to create a routine in the home so that everyone kind of knows things are predictable here. They might not be predictable at work or school, or whatever the case may be outside of the home, but they can be a little bit more predictable and a little bit more safe in the home environment. And then also increasing physical activity. So on days off, it's research says that that's a great way for people to de-stress, is to have some sort of physical activity, be it hike or yoga, something to kind of get out of the house, engage all five senses, and have that opportunity to kind of de-stress after the week.
Yeah.
So having those things become a part of your daily routine, I think would be beneficial. But before we go past that, I also want to highlight too, how do we support first responders? We also have to focus on the family too. So I would say, if you are the spouse or a partner of a first responder, or you have children together that are in the home, there, it would be beneficial. I would encourage you to, seek your own individual therapy and start processing your thoughts and feelings and concerns, which are just as valid as the first responders. They might
Mhm.
look a little bit different, but we want to be careful not to minimize our experience as the spouse or the partner or the kiddo of a first responder, because they're just as important. So that's another way we could just give them increased access to knowing what resources are available to them. And then also to increasing support, linking with a support system, and maintaining your identity outside of just we're a first responder family, having other hobbies and things that you enjoy and you can engage in outside of that as well.
Yeah, definitely all important. If the family is filling their cup, then they're also able to provide more support to the first responder
Mhm.
and vice versa. You're
Yeah,
all
absolutely.
connected as a family. Um, so that's wonderful. And you mentioned the five senses, and Kim and I just did a connecting with the five senses Pilates class. So those
Oh,
are
wow.
free resources as well. that are available on YouTube for additional support.
That's
Um,
wonderful. Yeah.
and I'm wondering, is there anything else that you think the audience should know?
There are actually so many resources, and that's I was in that spot myself at one time. Like I didn't know what resources to access. I had no idea about these websites. Another good resource is NAMI,
Mhm.
and that is an online resource. So it's the National Alliance on Mental Illness, and they provide information on mental illness, like education and support. So that's a good one to link up to. And then also, I'm not sure how far this video is going to spread and all of that information, but speaking specifically for Riverside County and San Diego County, you can dial 211 on the phone and you will be linked with someone who can give you resources. So if you're looking for a support group for a specific topic, you can call them and you can ask for information. If it's it could be anything. It could be an individual therapist. It could be a support group. That's a great resource. You could just pick up the phone and call 211.
Great. Well, thank you so much. And we'll include those links below this video so that people can easily access them.
Great.
Great. Thank you.
Thank you for having me. I appreciate the time.